Vesico refers to the bladder, and ureteral refers to the ureter. So, vesicoureteral reflux means that urine's refluxing or getting backed up. Normally, urine flows in one direction. It starts in the kidneys, goes down into the bladder, and when the bladder's full, urine flows out of the body through the urethra. In vesicoureteral reflux, there's some obstruction in that path, which causes pressure to build up and a current of urine actually pushes backward from the bladder into the ureters and kidneys. Now, there are two types of vesicoureteral reflux, or VUR for short. Primary VUR is the most common type, and happens when a child's born with a defect at the ureterovesical junction, which is the spot where the ureter enters the bladder. And this spot also acts as a valve, which prevents urine from pushing back from the bladder into the ureter. Normally, about 2 centimeters of the ureter sticks into the bladder wall, which allows urine to flow into the bladder. But as the bladder fills up and stretches, it also stretches out that section of the ureter and presses it against the top of the bladder, which causes the ureter to close shut. If the tube isn't long enough, though, that small piece of the ureter doesn't stretch very much, and it stays open even when the bladder fills with urine. In that situation, as the bladder pressure builds with more urine, it starts to go back up into the ureters. In secondary vesicoureteral reflux, there's an obstruction at some point in the urinary tract, causing urine to follow the path of least resistance, which often means flowing backward into the ureters or kidneys. Secondary VUR is most commonly caused by recurrent urinary tract infections, which can cause inflammation in the ureters, which makes them swell up and close. Another cause that's often diagnosed in babies is called posterior urethral valve disorder, which is when an abnormal membrane develops in the posterior part of the urethra, or the part closest to the bladder. And this prevents urine from easily passing from the bladder into the urethra. Yet another cause is a flaccid neurogenic bladder, which is when the bladder is unable to contract to release urine out of the body, even when a person's consciously trying to release the urine. This most often results from trauma, disease, or injury to the nervous system. VUR is usually classified by severity, grade 1 through 5, depending on how far the urine refluxes back up into the urinary tract. Grade 1 is least severe, and urine only goes up into the ureters. In grade 2, urine fills the entire ureter and the renal pelvis, which is the center part of the kidney. In grade 3, urine fills and starts to stretch both the ureter and the renal pelvis. In grade 4, the ureter is so swollen that it starts to get curvy, and the renal pelvis and calyces, which are the urine collection ducts, become moderately swollen and distorted. Finally, in grade 5, the most severe classification, urine fills up the ureter, pelvis, and calyces, which causes them to swell up completely, and this amount of pressure can lead to kidney failure. Individuals with milder cases show no symptoms, but in severe cases, urine lingers in the urinary tract for so long that there's very little flow through the urethra, which allows bacteria to move up the urethra and cause an infection. Chronic vesicoureteral reflux can cause pyelonephritis, or inflammation of the kidney, as well as renal scarring or fibrosis, which damages the kidney tissue. This damage can also reduce blood flow to the kidneys, and they can respond by holding on to more fluid to raise the blood pressure, which can ultimately result in hypertension. Vesicoureteral reflux can be diagnosed with an abdominal ultrasound, which can detect blockages in flow of urine and swelling in the ureters or kidneys. Another test, called a voiding cystourethrogram, or VCUG, can show how urine moves through the ureterovesical junction. In a voiding cystourethrogram, a contrast dye is injected into the bladder through a catheter, and X-ray images are taken to see if the dye moves from the bladder up into the ureters and kidneys. Another technique, called a radionuclide cystogram, uses a similar procedure as VCUG, except that it uses a radioactive tracer injected into a blood vessel. The scanner then detects the tracer as it moves from the blood and into the kidney, and then down through the ureters and into the bladder. Treatment for VUR depends on severity and age, since it mostly affects young infants and children. As a child grows, the ureter gets longer and the function of the valve improves. So primary vesicoureteral reflux sometimes improves or disappears over time. Some individuals might also need surgery to remove a blockage or to repair the valve at the ureterovesical junction. Alright, as a quick recap. Vesicoureteral reflux is a condition where pressure in the urinary outflow tract increases and urine gets pushed back up into the ureters or kidneys. Primary VUR is usually due to a short ureter, while secondary VUR is usually due to a blockage in the urinary tract. This disease often leads to urinary tract infections that can cause renal inflammation and scarring. Hey guys, thanks for watching. Hope you liked that one. It was actually done by our other illustrator, Vincent, so huge props to him on that one. In other news, we actually just made a subreddit called r/osmosit. So if you're a Redditor, you should go check it out. And if you're not a Redditor, you should also go check it out. Although I know Reddit can be a little intimidating at times. Otherwise, you can always donate to us on Patreon or subscribe to our channel or follow us on social media. You know, all that good stuff. All right. Bye, guys.